Hello everyone, welcome back to my channel. In today's video, we are going to talk about the top 5 career paths and high paying jobs that you can get after completing the healthcare administration program here in Canada. So let's get started. As we all know that healthcare administration is a program that is targeted for clinical as well as non-clinical, graduates. But at the same time, healthcare industry is growing so rapidly, especially in North America, that the need for these jobs is constantly increasing. And the moment you take this healthcare administration program on your resume, you open an array of opportunities and high-paying jobs, and we are going to discuss just that in this video. The number one role that we're going to talk about is as a healthcare administrator. As a healthcare administrator, you get to work in top-end clinics, hospitals, any healthcare organizations, physiotherapy clinics, dental clinics, or any big organization. So with the healthcare administrator role, you get to oversee the staffing issues, the finance, and you get to see you have to ensure basically that the facility provided to patients is of a high-end quality and is actually catering to all the patients' needs. So as a healthcare administrator, you basically oversee the management of that particular organization. And that being said, the remuneration or salary that you can expect from this role is around $100,000 per year. It can range from about a few $1,000 top plus or minus, depending upon your experience and the level of expertise that you bring to the table. The second role that we're going to talk about is that of a healthcare manager. So as a healthcare manager, you have to oversee or manage teams of healthcare professionals in any government organizations or healthcare organizations such as hospitals, clinics. And as a healthcare manager, you have to ensure that the organization is abiding by the rules and regulations set by the ministry and the provincial and government. And at the same time, you also have to oversee the functioning of the teams within the organization. As a healthcare manager, you are expected to make around $90,000 per year. The next role that we're going to talk about is of a health information manager. So as a health information manager, you are completely responsible for managing and securing accurate and private the data of patients, that is electronic health records. So you are responsible for seeing that the data is not leaked, it is private and confidential, and it is being properly maintained and being inputted. So this is your role as a health information manager. Now, according to the roles and responsibilities required by this role, there is a program in Sault College which is called as Health Informatics. So this role has a lot of roles and responsibilities common to what is being taught in that course. So in case if you want to get into as a health information manager in future, you might want to see this program, which is Health Informatics. It is not only offered in Sault College, but I think it is also being offered in a couple of different colleges as well. So get into the course if you're at this point of time looking for options on courses that you can do. So health information manager makes around $85,000 per year. So, and it's a pretty important role because all the electronic health records is under your supervision. So it's a very important role. The fourth role that we're going to talk about is of a healthcare consultant. As a healthcare consultant, you basically give advice to healthcare organizations on how to manage their staff, how to implement new policies, how to stay in touch with the recent rules and regulations that are being set by the government. So basically, you do a consulting job for healthcare organizations. That being said, as a healthcare consultant, you also have a pretty important role, because you have to oversee and analyze the data of the organizations and then provide your own input, as in what can be done to tackle the XYZ problems or issues that the organization is facing. As a healthcare consultant, you tend to make about $90,000 per year. Again, it differs upon your level of expertise and your years of experience. Last but not the least role that we're going to talk about is of a healthcare policy analyst. So with this role, you get to, you basically, more roles are offered in government organizations, also in healthcare organizations. And if you are someone who is interested in, making new policies or have that educational background or experience, you might want to think about this role, because this role is pretty important, because you get to oversee the policy making. You're basically, your role is to advise for any policy changes, analyze the data of the organizations, and put forward any amendments that you would like to make to the currently applied policies by the organization. So basically, it involves a lot of law and regulations, because all the policies here in Canada are according to the laws that are made by the provincial and the federal government. So policy analyst is I think a very interesting role, and someone who is interested in more of research and kind of wants to improve patient outcomes, because each policy at the end of the day directly or indirectly affects the patient. So your main goal is to see and improve quality standards for patients through your policies, be it new or be it the amendment of an existing one. And healthcare policy analysts usually make around $85,000 per year. So that is also pretty interesting role if you'd like to try. So that's it for today. These are just 5 roles that I have talked about, which are top end and high paying, but there are other beginner level roles as well that you can target. And as I say, that healthcare administration program is a very beginner level program, which can actually help you set your foot into the industry. And even if you're already practicing in the industry, it will help you to get that promotion and expand your level of knowledge and expertise, especially as an international student. When you travel from Asian countries, the healthcare industry is completely different as compared to this North American industry. So this program can help you understand it a lot much better, because the system here is more of insurance. It's not pay out of pocket as it's in India or any other Asian countries. So try to look into the criteria and the subjects that are being offered by the healthcare administration program, and it will help you better align your future goals to the roles that I have discussed in this video. So I hope you liked this video. If you did, don't forget to subscribe to my channel and let me know in the comment section if you're already working or if you would like to pursue any of these roles, and I'm here to help. So that's it for today, and thank you, universe.